Metformin is a medication primarily used to treat type 2 diabetes. Its use during pregnancy, particularly for conditions like gestational diabetes and polycystic ovary syndrome, PCOS, has been studied extensively. Here's a summary of key points. Use in pregnancy, gestational diabetes. Metformin is sometimes used to manage gestational diabetes when diet and exercise alone are insufficient to control blood sugar levels. It can be an alternative to insulin in some cases. PCOS. Metformin is often prescribed to women with PCOS to improve ovulation and regulate menstrual cycles, which can increase fertility. Its use may continue into early pregnancy in some cases. Safety. Studies generally suggest that metformin is relatively safe during pregnancy, with no increased risk of major congenital malformations. However, ongoing research continues to examine the long-term effects on children exposed to metformin in utero. Important considerations. Metformin crosses the placenta, meaning the baby is exposed to the medication. Healthcare providers carefully weigh the benefits and risks of metformin use during pregnancy on a case-by-case basis. Insulin remains a standard treatment for gestational diabetes, and the choice between metformin and insulin depends on individual circumstances. It is very important that any decisions concerning medication during pregnancy are made with and under the supervision of a qualified healthcare professional. Key findings and recent information, recent research, such as studies presented at the Endocrine Society's annual meeting, indicates that metformin may be as safe as insulin for managing diabetes during pregnancy, with no long-term adverse effects observed in children up to 11 years of age. However, research is still ongoing to fully understand the effects of metformin on fetal development. For example, studies are being done that look at how metformin affects fetal liver cells. In summary, metformin can be a useful tool in managing certain conditions during pregnancy, but its use should always be guided by a healthcare professional. Sources and related content.